Welcome to the Harpreet Singh Show. I'm your host Harpreet Singh from Surrey, British Columbia, Canada. Today I am having Dr. Jivasu from Hamilton who will be talking to us about his experience of talking at the CINI conference because all the speakers who spoke at the conference will be talking to us and sharing their wisdom. And before I get Dr. Jivasu on the program, I would like to just introduce him and we will learn from his wisdom as to what all he has done in his life. Dr. Jivasu is a spiritual teacher, a physician, founder of Naturality, and Jivasu's teachings emerged from his direct spiritual experience. Dr. Jivasu was born and raised in India. From a young age, his interest lay in understanding the depths of human consciousness. He trained as a pediatrician, and after meeting his wife Karen, they moved to the Indian Himalaya foothills to serve marginalized communities. Even as he worked as a physician, Dr. Jivasu continued his spiritual studies, and with his medical background, he became deeply interested in the link between science and spirituality. Later, he studied integrative mind-body medicine at Harvard Medical School. So, he spoke at the conference about the science of yoga as seen by a medical man, why yoga practices integrated to health and modern science. Let's welcome Dr. Jivasu and learn from him as to what he has to tell us today. Dr. Jivasu, welcome to the program.
Thank you very much.
Thank you very much for your time. Thank you. So, sir, what you spoke at this conference, we heard you for some time, but as in this program, we are hearing in details. Could you please elaborate about your talk, what you gave at CINI 2021?
Right. What we are exploring nowadays is integrative medicine. And what that means is that we are bringing together ancient wisdom and contemporary science. Because the health problem in the present world are very different from the past. 100 years ago, most of the problems were of deficiency. We didn't have clean water, enough food, not even vaccines in those days, a lot of infectious diseases, and average life expectancy was very low. But in last 40 years, it is all changed. We are living a long life, but also our health problems are due to lifestyle. We have excess of everything. So most of the diseases are related to heart, high blood pressure, diabetes, cancer, autoimmune disease, chronic pain, stress, anxiety, and depression. And all those problems with a long life can not be tackled by Western medicine or mainstream medicine. We have to bring something about lifestyle, because no health system can afford to provide for a person for 80 or 90 or 100 years through the hospitals, through the clinic, because those problems originate from lifestyle. When we are not eating properly, not exercising properly, we are not sleeping properly, so those problems will exaggerate. So we have to bring two systems together, modern, contemporary medical system, and also ancient systems of healing, which emphasized on a good lifestyle. So a person can take partly care of himself or herself, which will give also control to that person on his or her life. Otherwise, as we age, we will be running to the clinic and hospital and doctors and all kinds of therapy. And that is what we call integrative medicine. Now, the integrative medicine, one part of course is medical. The second part, which is holistic, that comes from yoga. Yoga, as we know, is many thousand years old, And the beauty of yoga is it is very scientific. It is not a religion. It is not based on faith. The idea of yoga is that in our laboratory of mind and body, we experiment with something, see its result in our life, and if they are good, then we continue. If they are not good, then we stop them. So what happened in last 40 years, there are many researches done on yoga. And what they found, when we do yoga, which is not only physical poses, asanas, but also breathing practices, also meditation, lifestyle, and also knowing our personality. Because whatever we do in our life has to be aligned who I am. I cannot just write a single prescription to everyone because a single size doesn't fit all. So what happens in the yoga? It has 8 limbs, so it's very logical. It proceeds in sequence. So the first part of the yoga is called yama, and yama, what we do, we build our personality rooted in our family, in our community and culture. Because once we are rooted, that is going to give us a solid grounding. Emotionally, we will be more secure. We won't be so much tense. Stress will be less. Even if the anxiety comes, we will be able to share with the family. So that already relieves so many problems, because we know in modern life, and particularly in a country like Canada, it is so easy to become lonely, because that is how life is. So the first part is to build my identity. Then the second part is that I must know my personality, because I'm born with a unique personality. No two people can be ever the same. So once I discover my personality, my life's energy, my body and mind, what kind of emotions I have, then I can discover my lifestyle. How much I have to sleep, how much I have to exercise, what kind of food is good for me, what kind of work, what kind of relationship even, what kind of home, what kind of clothes, and so on and so forth. Because once I align my whole lifestyle according to my personality, I will experience a sense of flow. Flow, the word comes from flow psychology. That means I feel good about myself, that I sleep good, that I don't go through extreme high blood pressure when I'm stressed, that even if I develop anxiety, I can take care of it myself rather than going to the doctors. And then after that comes yoga practice, asanas. And it is very well known that once we are doing these yoga poses, the stimulation goes to the brain, to the emotional centers, to the centers of the endocrine glands, and from there to the immune system and the whole body. And in modern medicine, it is called psycho-neuro-immuno-endocrinology, means mind-body medicine. So in essence, this yoga is mind-body medicine, that through the mind, it will affect my whole body. And almost 80 to 90% diseases of our time are connected with the mind, which is different from 100 years. So if you look into high blood pressure, into diabetes, chronic pain, sleep disorders, allergy problem, asthma, cancers, somewhere they are all connected with the mind. So that is what yoga does. It calms down the mind, and through the mind, the whole body. And so much research work is available. And first one was Robert Eder, who proved it. After that comes breathing exercises. Very simple, we can do them anywhere. And breathing deeply for 20 times again will relax us. And then comes meditation practice. So in essence, yoga means I'm rooted in a family and community, knowing my personality, my lifestyle according to that personality, and few practices. So what it does my whole system into homeostasis. So this is a word which comes from medicine, homeostasis. Homeostasis means a natural balance. So it doesn't work on any particular disease, but it creates a wonderful equilibrium between my heart and the brain, in my gut and muscles, my endocrine and immune system. So once my system is in balance, it will take care of many health problems in terms of prevention, or even when they are there, it will relieve or possibly cure them. And it will save a lot of health resources, because once learned, which is very inexpensive, it becomes the part of my life. I will have better energy. I will feel good about myself. My pain will be less. So my visit to the clinic, to the doctor, hospital will reduce dramatically. And there are many researches about it. And that is why in US, some companies, insurance companies, are funding these programs. Because it is not religious, it is scientific, and combined with the modern medicine is the ideal combination. Partly I'm dependent on health system, but for rest, I'm taking care of myself. I have control. I'm not a dependent human being, even in ripe old age. So that is what the integrative medicine is all about, and that is what yoga can contribute to it.
Right. Wonderful. Wonderful analysis and wonderful talk, Dr. Jivasu. My question to you would be, we all know that we are responsible for our own health, but what do you feel? How to align, because that is what you have said, to align ourselves with ourselves. But we do not know that. We get enticed by a lot of things, and that affects our body, mind, and soul. So, what would be your recommendations? You have been in this field for a long time now. So, what would be your recommendations from where to start and what all to start, so that we can start developing on that aspect and improve our health mentally and physically?
Right. The most important component to enter into integrative medicine is education. And education either at primary level, because many high schools in United States, even in Canada, allow yoga. So either at that level, or at least at the level of medical school or university. And actually it is happening, because I was a part of the McMaster, and in McMaster there is a mind-body program, there is a yoga program. So for university student and also in medical school, if doctors are aware, then what they will do, they will transmit this knowledge to their patients. Because in Canada, a family doctor is the core of healthcare.
Yeah.
They are excellent. But it is quite possible many of them are not aware about it. So if something is important during that education, they will take it to their patient, actually, which is happening all over the world. Because in Mind Body Institute, where I got my training, is Harvard Medical School, medical doctors, they come from all over the world and they are trained in basic mind body medicine, which has a very big component of yoga and meditation.
Right. So, Dr. Saab, you said awareness is a major factor which needs to be incorporated, and it is happening. But from a common man's perspective, what would be your recommendation to them? Where can they start on this? Because yoga, again, by many is just considered to be some few exercises. But when it comes to implementing these things, where to start? How can a common man start on aligning oneself with themselves?
Right. Again, the most important part again come to the same thing, that education. So unless they are exposed, they won't know. And now what happened in last 10 years, these centers of yoga and meditation and similar holistic perspective are everywhere. In Hamilton only, which is a medium-sized city, there must be at least 50 of them. So what I'm trying to say, that after initial awareness, if we have some place to go, we will start from there. And yoga doesn't mean only yoga asanas, because older people cannot do that.
Right.
But they can take other practices which are easier. And also they can understand about their whole constitution, about their personality. So unless there is a awareness, unless there is a education, it is not going to spread. But fortunately, all over the world, that is happening rapidly.
Right. And how do you feel conferences of these kind, where the best of the East and the modernity of the West is brought, amalgamated and brought forward? How can these conferences play a pivotal role in creating more awareness? What do you have to say about that?
That's right. Actually, if you really look into the history of education, the new education always spread in the beginning by meeting of the like-minded people, bringing new ideas. And when those new ideas were percolated in the media, it took few years, but eventually they spread. So these kind of conferences are of vital importance. And this process is going on for many centuries, whether it is science or anthropology, medicine, engineering, or holistic meeting. So all over the world, hundreds of these conferences and seminars are going on for last 30, 40 years. So they play a very important role to bring the ideas together, and through media or people who are attending, it spreads out and it almost becomes like a nuclear chain reaction.
Wonderful. And if people want more information, they can visit your website, jivasu.org. Dr. Jivasu, thank you very much for your time, for elaborating on what you spoke at the CINI conference. And the Harpreet Singh Show has a wonderful relationship with CINI, because every month's second Tuesday we have a guest coming over here who talks on this integrative approach towards health and trying to create awareness so that we become responsible for our own health and do not become a burden on the health system. So thank you very much, Dr. Jivasu, and thanks to Dr. Garg for introducing you to us. Thank you very much.
Well, thank you very much, Harpreet Singh ji, because I think you are playing a very vital role in spreading these ideas. So thank you
Thank
to
you, sir.
you also,
Thank you very much.
educationist. Okay.
Thank you. So this was Dr. Jivasu, and we are thankful to Dr. Garg and his entire team of CINI, who has worked so hard in getting this conference organized and also getting all the guests on the Harpreet Singh Show. And as I said, if you want more information regarding this aspect, you can visit jivasu.org, where you'll get all the information. And this concept of mind, body, soul, which is coming up in a big way now, people are understanding the importance of this. But it all starts with us. We need to start incorporating these ideas into our lives so that we become better in our health and we also contribute to the society in a better manner. Thank you very much for watching this program, and otherwise I am with you every evening at 7 p.m. Pacific Standard Time, where every day we have a different guest from Monday to Friday, and our focus is to empower you, educate you, and to inspire you. Thank you. Once again, welcome back. My next guest is Dr. Hannah Nette. She works at Inspire Health, and Hannah Nette is a physician and director of clinical services at Inspire Health. Dr. Hannah Nette was raised and medically trained in Nova Scotia after years of working as a full-service family doctor in Vancouver. Hannah was thrilled to join the Inspire Health supportive cancer care team in 2013. When Hannah is not passionately engaged in her work as one of the leaders and physicians that Inspire Health, you can find her searching for hiking trails and scenic picnic spots with her family, and she's a great nature lover. So let's welcome Dr. Hannah and learn from her as to on the topic what she spoke in the conference. Dr. Hannah, welcome to the program.
Thank you. It's a pleasure to be here.
Thank you for your time. So in the conference we just concluded, you spoke on what can be done for chronic management in cancer care and integrated approach. So can you take us on this journey as to what you specifically talked in this conference, and how people who are suffering from cancer can take advantage of the wisdom you have?
Certainly. Well, thank you for the invitation to be here with you today. And here's what we know. We know that 1 in 2 Canadians is predicted to be diagnosed with cancer in their lifetime. So really, truly, cancer does affect us all. And we know that more and more these days, cancer is, for many people, a chronic condition. And when we think about how to support, ourselves and others with a chronic condition, we know that lifestyle approaches and integrative approaches to supporting our health and well-being as we journey through a cancer experience or live with cancer, that these approaches make a big difference. They make a big difference to how we feel, to our quality of life, to our well-being, to our mental health. So that's why it's so important to be talking about cancer and many of the other chronic diseases that were discussed at the recent conference. So here's what patients tell us. Patients tell us that when they experience a diagnosis of cancer, they recognize that our acute care system, when it comes to cancer care, is very effective. The COVID pandemic has challenged that experience for many people. We know that there have been delays in receiving services, delays in diagnoses sometimes, delays in surgeries. But in general, our acute care system is very effective. But when we look at studies that examine how people sort of fare and how they experience a cancer journey, what they tell us is that there are gaps in the support that they receive, particularly in some of the lifestyle pieces, in the areas of counseling and mental health support, in emotional support, in areas of managing a nutrition plan, and in getting support to get moving again after cancer or during cancer treatment, which we know there's lots of evidence to support that if we're able to keep active during cancer treatments, that we have we can benefit with reduced side effects from the treatments, increased tolerability of cancer treatments. So this is very important science-based, evidence-based support that patients tell us that they're not always receiving. So Inspire Health was founded more than 20 years ago by 2 medical doctors in British Columbia who really saw the need to support patients with cancer and support their families during an often incredibly stressful time in their lives. We know that as I mentioned, the acute care medical system, so the system that would be providing surgery for cancer, chemotherapy, radiation, that they do an excellent job at supporting people through a cancer experience. But we really need to think about the whole person, and the person who is at the center of this journey, and find ways to support, from a perspective of a mind, body, spirit approach, to support that person who's at the center of the cancer experience. So support them emotionally, physically, and mentally. And what we know is that when we personalize or individualize support for the person, that's when we're going to get the best fit for them. That's when they're going to feel the most engaged and empowered by the support they're receiving. And we know that it really does often take a team. So a team of professionals, and that's what we have at Inspire Health. We have medical doctors, physicians like myself, supportive care physicians. We have clinical counselors, we have dietitians and exercise therapists. And we're all here to get to know the person and individualize, personalize a plan for them to support them through their cancer journey. We're also here to support people. Mm-hmm. So we know that the burden of caregiving can really bring with it its own stresses and its own impacts on the health of support people. So we're also here to support them as well. So how do we do that? Yeah. Well, we do that both with individual support, so that one-on-one support, getting to know the person, what are their goals, what are the gaps that they're seeing in the care that they need and the support that they need. And then we also have a lot of group programming. So we have exercise classes and cooking classes and support groups and many other meditation classes. And in the run of a week, we support about 20 different classes in all of those disciplines. So all of these services are available at no cost to Canadians with a cancer diagnosis and their family members. And we, since COVID has arrived on the scene in March 2020, we pivoted very quickly to provide all of our support online. So if people want to be connecting with us over the telephone, if that's most comfortable for them, then we're here for them via that modality as well. And all of our classes and group programs are available through a very simple to use video conference system. And we have incredible engagement that we've right. seen. Over 34,000 visitations for services in the first year of COVID. So that's quite incredible. And in any week, we have hundreds of people joining us for exercise classes from living rooms across British Columbia and beyond to engage with our services. But what we know is that, and I'll conclude after this, what we know is that we still have a lot of challenge getting the word out that we're here. So we did a survey last year in 2020, and we found out that, we certainly know that many populations within our communities aren't hearing about our services. So for example, we're only seeing about 3% of our patients are from the South Asian community. So we really value opportunities like this and the conference to get the word out that we're here, that we're available, that we're free, and that we don't require any referral, and that our support is professionally based, science-based, integrative. We work collaboratively within your healthcare team to support you.
Excellent, wonderful. Thank you for laying the foundation of our talk. So a few things. Let's start with you. From a full-service family doctor to a person who believes in an integrative approach. How did this change happen? How did you come to this side?
So, integrative medicine was at the heart of my work as a family doctor.
Okay.
My practice was in quite central Vancouver, and I was really fortunate to be able to support full service family practice. I delivered
Right.
babies at and I was able to provide some in-home palliative care support.
Okay.
And so I really value the primary care experience that I had. And what I did find was that when somebody was in a particularly challenging time, such as what is often taking place when a cancer diagnosis is new to a person, or they're experiencing, a lot of questions or confusion about how to navigate the system, that oftentimes more care is needed. So what I would experience in primary care was that I would look for where are there integrative supports that could support an individual beyond what I could do in my family practice, and then I had the opportunity to look a little bit deeper into that when I had a close family member who was diagnosed with cancer. And when I was looking for supports for them, but also for myself, thinking about myself as a support person for them, I found Inspire Health. And from that moment, I attended some programs, and for me, it was a model of care that felt completely aligned with what I had come to medicine to do.
So, Dr. Hannah, your services are confined to just British Columbia or whole of Canada?
All of Canada, all Canadians can access our service.
Okay,
yes.
Wonderful, great. So you pointed out in the beginning that 1 in 2 Canadians can have cancer. The statistics are very high. Can you point out what are the major reasons in your research that are coming out? Why is this cancer spreading like wildfire?
Well, it is. There's a complex answer to that, for certain. We know that cancer, the incidence of cancer increases as we age. So we know that part of it is that we do have a population that's living longer. So that's certainly a component of cancer. The other, when we look to the literature and to the reasons why, the other things that do come up are that there are lifestyle factors that, again, it's not always a cause and effect, but there are associations that we see. So when we see higher rates of things like obesity in the population, and challenges with maybe a higher processed diet, we do see higher rates of cancer associated with those things on a population level. Smoking remains the one of the key contributors to cancer. So although we have done well getting on a population level, getting our smoking rates down, we know that we still have lots of work to do in this area for people to feel really well supported with smoking cessation. And we know smoking cessation makes a big difference. So when we see that somebody's able to be supported to reduce or eliminate smoking, even after a cancer diagnosis, it makes a huge difference to outcomes. So, there are lifestyle factors. And cancer is what we call a multifactorial condition. So we know that it would be rare that there would be one contributing cause to cancer. And for many people, with a cancer diagnosis, they're not coming to us and, saying, this is exactly what caused my cancer. There's often a lot of questions about that. And one of the things that we talk about is, we won't know the cause of your cancer, but how can we, moving forward, support you to feel the best that you can and heal the best that you can. So
Dr. Hannah, when the cancer is diagnosed, it is a roller coaster journey, physical, mental, emotional, for the patient as well as the family. So what would be your recommendations to them at this time, once the diagnosis is done and the treatment has started? So, from a general advice we would like from you for the people to know as to what they can do so that they suffer the minimum.
Thank you for that. You know, the word that is often used by patients we see is just the word that you just used, is the roller coaster. The fact that, and sometimes it can be quite unpredictable. You know, people can feel surprised that the intensity of emotions, you know, for example, often people will say, you know, my treatment's complete. I thought I would feel so relieved, but I actually feel like a lot of fear is coming up now, because now I maybe don't feel as protected by the medications that we're treating the cancer. So there's truly a roller coaster. And so what I would say is everybody is going to be different, but if you're feeling like day to day things are challenging, there's support available, and there's no one right time to get support, but one of the things we hear from people is, I wish I had known about, your services or supportive care services earlier. I didn't realize what a difference it would make for me. So I would say if there's, even an inkling of, could this help for me? Seek it out and try it out. Because for many people, it's surprising how much a little bit of support can support not only themselves, but their family members as well, and how much of a difference it can make. And you're in the driver's seat. So our approach at Inspire Health is incredibly empowering, and you guide the path forward. So you're never going to be forced to, go in a certain direction or be supported in a certain way. It's all about what would work best for you, and how we can meet your needs. And we listen to what people are telling us as far as what supports they would benefit from and what to connect them to. Right. So there really is something for everyone. And the truth of it is we all do need support, or we could all benefit from support.
Right. So where can they go, and what's your website where they can find all this information?
So the website is inspirehealth.ca. It's quite easy. And then we also, we really try to make it very easy to connect with us. So if you dial a phone number, our goal is to pick up the phone and you can talk to a human being and get started that way as well. So we absolutely have a platform of registering and getting started online, but our hope is to really meet your needs and pick up the phone if you'd like to talk to us over the phone.
So can you share the phone number also, please?
Certainly. The toll-free number is 888-734-7125.
Wonderful.
So that's 888.
Okay, yeah. Great. And Dr. Hannah, I would also like to know from you your perspective, because you believe in integrative health, and this conference was just concluded. We had speakers from all over the world who were sharing their wisdom, the wisdom of the East and the modern science of the West. When they amalgamate, it can create wonders. So what do you feel, what is happening towards this end when conferences of these kind of held? How can they further help in disseminating information in the medical fraternity and bring both the sides together?
Well, it's the integration is the future. And I think we've known that for some time. And so conferences such as this, they're incredibly inspiring. And I do believe we've been at a tipping point for some time. And what it has taken to cross over into this becoming more and more commonplace, this type of collaborative, integrative approach, is all of us as a populace saying this is what we need to fully support ourselves, because we're better together. And often we talk about limitations, or we recognize that there are gaps, but when we look at integrating everything together, that's when we're going to be able to best address those gaps and use all of the incredible wisdom and evidence that we have to support all of us. And this affects all of us because we are all going to ultimately have some sort of disease or illness that we are going to need to, manage or address or deal with on for ourselves. And the integrative approach is going to be where we see those best results for us as individuals and for our population as a whole.
Right. And Dr. Hannah, one last question is that we've talked about the diagnosis, but it's always said prevention is better than cure. What would be your recommendations to people to prevent this? Of course, there are various factors you have talked about which can lead to cancer, but what would be the recommendations that people start adopting now only so that they can save themselves from this dreaded disease?
Well, thank you. Prevention is certainly something that I think about every day because I do this work and I'm always reminded, okay, how am I supporting myself? So I would say there are many pillars of health that we probably touched a little bit on today, but for our physical health and mental health. Keeping ourselves moving. Our bodies really do thrive with some movement in our day. And we know that exercise plays a key role in preventing cancer. And then nourishing ourselves with, a diet that feels sustainable for us and we can maintain an optimal or somewhat, consistent body weight is a really important part of our health. Adequate sleep is vital and it makes a huge difference. Every component of our body gets restored and replenished in our sleep. And then, I would say stress reduction is a huge piece. It's complex how stress is connected to cancer or to disease in general. But what we know is that when people have practices, whether they're a meditation practice, a yoga practice, qigong, those are all classes that we offer at Inspire Health every week. We do that because we know that there's really good evidence that these support our whole health, our mind, body, and spirit to thrive and to use our bodies in the best way possible, because we know we are built to manage disease and to recover from illnesses. Right. That's the way our human body was built. So it's working with the natural instincts of our body to heal.
Wonderful. Dr. Hannah Nette, it was a pleasure talking to you. Thank you for your services, and we hope from this talk people take advantage and they can call at 1-888-734-7125 or go to your website inspirehealth.com or .ca.
Thank you very much.
Thank you.
We welcome
Thanks
you all.
A lot. Thank you.
ਪਾਪਾ ਤੁਸੀਂ ਅੱਜ ਕਿਉਂ ਉਦਾਸ ਹੋ?
बेटा तेरे चाचा दी कोरोना वायरस करके डेथ हो गई है क्योंकि उसने मेरे कहने के बावजूद भी टीका नहीं लगवाया।
ਚਾਚਾ ਜੀ ਤਾਂ ਪੜ੍ਹੇ ਲਿਖੇ, ਸਿਹਤਮੰਦ ਅਤੇ ਰੋਜ਼ ਐਕਸਰਸਾਈਜ਼ ਕਰਨ ਵਾਲੇ ਸਨ, ਫਿਰ ਉਹਨਾਂ ਨੇ ਟੀਕਾ ਕਿਉਂ ਨਹੀਂ ਲਗਵਾਇਆ?
ਉਸਨੂੰ ਡਰ ਸੀ ਕਿ ਇਸ ਟੀਕੇ ਦੇ ਮਾੜੇ ਪ੍ਰਭਾਵ ਹੋ ਸਕਦੇ ਹਨ ਅਤੇ ਇਹ ਸੁਰੱਖਿਅਤ ਨਹੀਂ ਹੈ। ਹਾਲਾਂਕਿ ਮੈਂ ਉਹਨੂੰ ਬਹੁਤ ਸਮਝਾਇਆ ਕਿ ਇਹ ਸਭ ਅਫਵਾਹਾਂ ਹਨ ਅਤੇ ਇਹ ਟੀਕੇ ਵਿਗਿਆਨਿਕਾਂ ਅਤੇ ਡਾਕਟਰਾਂ ਦੀ ਮਿਹਨਤ ਅਤੇ ਖੋਜ ਦਾ ਨਤੀਜਾ ਹਨ।
ਪਾਪਾ ਹੁਣ ਤਾਂ ਸਾਡੇ ਸਾਰੇ ਪਰਿਵਾਰ ਦੇ ਮੈਂਬਰਾਂ ਨੂੰ ਟੀਕਾ ਜ਼ਰੂਰ ਲਗਵਾ ਲੈਣਾ ਚਾਹੀਦਾ ਹੈ। ਸਿੱਖ ਹੈਲਥ ਫਾਊਂਡੇਸ਼ਨ ਦੀ ਅਪੀਲ ਹੈ ਕਿ ਅੱਜ ਹੀ ਵੈਕਸੀਨੇਸ਼ਨ ਕਰਵਾਓ ਅਤੇ ਆਪਣੇ ਨਾਲਦਿਆਂ ਨੂੰ ਵੀ ਟੀਕਾ ਲਗਵਾਉਣ ਦੀ ਪ੍ਰੇਰਣਾ ਕਰੋ। ਆਓ ਅਸੀਂ ਸਿੱਖ ਹੈਲਥ ਫਾਊਂਡੇਸ਼ਨ ਦੀ ਇਸ ਮੁਹਿੰਮ ਦਾ ਹਿੱਸਾ ਬਣੀਏ।